Good morning, everyone. Thank you for joining us today for the first TAHP covered forum, Moving Forward, Minding the Transportation Gap in Texas Healthcare Coverage. Today's forum will focus on the importance of transportation in healthcare and is scheduled to go until 12:30. You can find all descriptions and link to each panel on the Texas Covered website. My name is Angie Hochhalter. I'm the Vice President of Quality at Scott & White Health Plan. I will be moderating our first panel today, and it is titled Removing Barriers and Improving Care, Why Transportation is the Most Important Social Determinant of Health. Now, before we get started, I want to let all of our attendees know that if you have questions or comments during our discussion, please type them into the chat box. We're going to be monitoring the chat box, and I can surface those questions for our panelists during today's discussion. So we're looking forward to seeing your questions in the chat box. To begin today, we're going to hear brief introductions from each of our panelists. So we're going to start with Monica Rivera. Monica is the Vice President of Growth and Business Development with LogistiCare. Monica, good morning.
Good morning, Angie. How are you?
Great.
So like Angie said, my name is Monica Rivera. I lead growth for LogistiCare, and basically what we do is we help state governments, health providers, and health plans run transportation and integrated care programs around access to care and outcomes. We cover around 25 million members in 50 states and DC and do 60 million rides per year. Thank you for having us, Angie. We're excited to be here.
Wonderful, wonderful. Thank you, Monica. All right, next up we have Chris Irwin. Chris is the National Director of Innovative Solutions at Access to Care. Chris, good morning.
Hi, good morning, Angie. So just a little bit about Access to Care. We're the managed transportation division of a larger healthcare company, Global Medical Response, or GMR, who's the largest ground and air medical transport provider in the world, serving 47 states and 150 countries. We're also the prime FEMA contractor for the last 14 years. And we have a breadth of experience in Texas. We're the original broker actually in Texas under the former TSAP model. Been contracted with HHSC for the last 14 years. Our operations, call center, dispatch, network management, all located out of our Houston office. So we're really excited to be part of the association discussion today. Thank you, Angie.
Great. Thank you, Chris. Thank you, Monica. We're going to go ahead and dive on into our first question here. Monica, I'm going to start with you. Let's talk about COVID-19. What trends in transportation were you seeing before COVID-19 and that pandemic started? And how do you expect that COVID will change transportation moving forward?
So that's a really interesting question. And one of the silver linings about COVID-19 is we're all experiencing it some way, somehow, right? So there's no one that doesn't have the impact or the effects. That includes us as people, companies, our members. So how I think about it is before COVID, transportation was really seeing a surge around social determinants of health, but how people thought about it, it was really still very centered around getting patients to a care site and kind of navigating that care continuum so the patient would get there. I think with COVID, the take a step back and let's think and be thoughtful about this. There's really been a shift in how we think of how we get care to patients instead of patients to care. So there's always going to be a need for patients to get transported for dialysis and some sort of ambulatory appointments. But as you think about it, what are the components that could be delivered at the home? And then what are the steps that we need to take to really facilitate that? So we've been doing a lot around providing care to home health providers and providing food to Medicaid beneficiaries around the country. So that's what's really changed, and I'm really proud of our employees and our company in really just shifting that and doing everything in a member-centric way.
Yeah, interesting. Thank you. Chris, what are you seeing from your perspective around COVID?
As far as trends, before and during COVID, nationwide, we were generally seeing year-over-year increases in utilization. The reason is because health plans acknowledge the value of NEMT or non-emergency medical transportation. They've continued to enhance their transportation programs to alleviate barriers to accessing healthcare. And of course, the more convenient you make transportation, the more members will want to use it. Now, during COVID today, NEMT utilization is down significantly as routine medical appointments have decreased or been replaced with virtual appointments. But the most interesting trend is the impact on rideshare. There's less drivers on the road not wanting to put their health at risk. Rideshare has largely become unreliable in many regions. We have what we call our Rideshare Center of Excellence that proactively monitors rideshare capacity at the local level. And they shift trips to traditional providers who have remained operational. So prior to COVID, where available, rideshare averaged about 40 to 50% of ambulatory trips. Today, we're less than half of that. Now, while we expect rideshare to rebound, it will still require the team to actively monitor driver adequacy to make sure it's available to your members. But more than ever, this will be needed once we get back to the new normal, as rideshare capacity in local areas fluctuate. Outside of that, I think the new normal will be interesting to see how virtual appointments and telehealth will have just an impact overall on the need and the demand for NEMT services.
Mm-hmm. Great. Thank you, Chris. Chris, as a follow-up to that, I hear you saying that you're seeing some lack of stability in rideshare. Any thoughts on whether that will continue, or is the message there we really have to create an infrastructure that can flex as different types of availability come and go?
Absolutely. I think it's just being flexible, having the tools in place to monitor, as well as a team that can monitor those trends. And it has to be at the local level, right? In the urban areas, we're generally seeing appropriate capacity. But outside of those urban settings, it's the pretty much any rural areas where they already were impacted by rideshare because it's difficult to be efficient. But it's just going to be something that's going to be monitored at the local level.
Yeah.
Angie, and if I might latch on to what Chris is saying around rideshare and your question about flexing up or down. So if you look at national trends around virtual visits, we actually peaked at hospitals in May, where 40% of visits were virtual visits, and now we are at 5%. So that's certainly much higher than the 0.15 that we saw pre-pandemic. But to your point and Chris's point, it's about that new normal and really being part of that healthcare continuum where you flex up or down depending on obviously where the pandemic heads. If we have a reliable and good vaccine, all of that, and really flexing to meet the member and the patient where they're at.
Yeah, great. So I'm going to remind our attendees that please feel free to jump into the chat box there and add questions. I'm going to go on to my next question here, and in a minute we're going to be joined by another panelist. I will introduce him as soon as he is on video with us. So let's move on to the next question. In the meantime, Chris, I'm going to start with you on this one. Tell us a little bit about how your company works with communities.
I hate to interrupt.
Yes?
Angie, can you hear me? Hi, this is Stan Sipes. I'm here, but I'm having the hardest time getting my camera to work and my microphone to work or anything else.
Well, good morning. We can hear you, and if you're willing, we will have you join our conversation. And until we can see you, we'll have you join by voice, if that's all right. Let me introduce you first. Is that all right?
That's fantastic. It says, yeah, my name. Hi, everybody, and I apologize. We're a technology company, yet I've seemed to be having a lot of technology issues this morning. But my name's Stan Sipes. I'm the Executive Vice President of Business Development for Veyo. Like LogistiCare and Access to Care, we're in the NEMT brokerage business, and our job is to manage the benefit for managed care organizations and state agencies across the country. Veyo is somewhat unique in the industry in that we actually didn't start until about 2016, when a couple of companies had been working together for about 4 years, decided to merge their forces to create a brand new NEMT company. And I don't want to interrupt this very long. Most of the listeners probably have heard of Veyo. But the two things that we brought to the industry that have enabled us to grow across the country quite quickly are, number one, we created rideshare for Medicaid. And what I mean by that is we created a rideshare concept that is designed specifically for the population, the Medicaid populations that we serve. These drivers meet or exceed all NEMT credentialing and training standards, not just because they're standards, but because we believe they're very important for the care of Medicaid patients. And the second thing we've done is we created a vertically integrated technology platform designed specifically for the management of this benefit that connects all stakeholders throughout the process: the member, drivers, the healthcare provider, the managed care organization, and our organization, our call center agents, our command center agents, and our staff, to ensure that we're able to transparently and in real time manage this benefit as best as possible. So with that, I really apologize. I've been looking so forward to this for so long, and when technology steps on you, it's so frustrating. So with that, I'll turn it back over, Angie, and Monica and Chris. I apologize.
Thanks so much, Dan, and welcome by voice to our conversation. We're just moving on to a question here about communities, so we'll come back to you in a bit. I'm going to jump to Chris. Chris, we are really interested in how access to care is working within communities, with communities to address social health needs, the social determinants of health, broadly speaking. Chat with us a little bit about what y'all are doing in that area.
Sure. So first and foremost, I think you must understand the needs of your communities and the needs of the stakeholders in that transportation process. Our organization is the 911 provider for communities across Texas, and we use that organizational knowledge to develop solutions on the non-emergency side. And at the same time, you don't want to make the error of assuming you know the needs of those local healthcare providers, even though we have that extensive experience, since all healthcare companies operate differently, these providers and health systems. Consider hospitals, for example. Today, when a Medicaid beneficiary needs discharged, there's just one toll-free number under the state MTP, or Managed Transportation Program, that they call to coordinate that discharge. As of next June, during the carve-in, there'll be a scheduling line for each of the Texas managed care plans, as well as the various technology offerings that each of the brokers offer. So how they will educate and operationalize that amongst their nurses, their social workers, their discharge planners. So we're currently doing some hospital surveys across Texas that we've done in the past in other markets to understand their needs and create programs for success. So it's really having those ties and the local relationships in the communities that make NEMT successful.
Great, thank you, Chris. Now, Monica, you started by saying that some of what you've seen, and I'm happy to hear this as well, with COVID, is that you're seeing more of an interest beyond just medical transportation to transportation related to other social determinants of health, other health needs. Tell us a little bit about what you all are doing with communities and in communities.
So it's funny because I think I've heard both sides around social determinants of health, right? I've heard people say, we're tired of hearing about it. And I want to say to those groups, I hear you. Let's not talk about it. Let's actually do things that impact social determinants of health and measure those outcomes around total medical spend, around the life and well-being of Medicaid beneficiaries. So we at LogistiCare, we believe that healthcare is local. So you know healthcare in one city or one county in one state, you know healthcare in one city, one county, or one state. So the very unique thing about LogistiCare is that it has a national infrastructure with very locally based community, employees, resources, deployment. So what we do is we have outreach personnel in all our communities, specifically around Texas. We work with children of migrant farm workers, and that is not as applicable in Austin, for example. In Austin, we see much more of a need with other types of communities. Austin's a melting pot of communities, so we work a lot with the Ronald McDonald House. So what we like to get to when we work at any community is understand the community, understand who lives there, who works there, and then work with the health providers and payers to really impact that. One of the things we've done is we partnered with Miami-Dade and their school system to transport food to the kiddos that are going to school virtually. So you think about those kids, they only have one good meal a day many times. They're not going to school. So how do we get those meals to the kids? So some of the things we're proud of. So again, getting care and food to members and family members, and really driving care to the member instead of waiting for the member to come and ask for care.
Oh, great. So Stan, welcome. We can see you. We're happy to see you. Stan, Monica, and Chris have talked to us a little bit about how important it is for the transportation vendors to be local, which I think makes sense. You really understand what the different needs are in the local communities, and you get to hear the stories, right, during the rides. Tell us, Stan, from your perspective, what are you all doing with communities and within communities to address social health needs?
Yes, and I'm sorry, I'm going to check again. You can hear me, right?
So we can hear you. Welcome.
Oh, great. Core to our company, when the two companies that came together to form Veyo, one of those companies is a company called Total Transit that has a now nearly 40-year history in Arizona. Grew up as a local community-based transportation company in a variety of different transportation modes, right? Taxi and public transit and NEMT. And as a result of that, as we grew up from being a small local organization, our culture is we have always been engaged in the community, and it's just part of the fabric of who we are. So, whether it's a, moms and kids charity or food drives or just about every individual in our company is involved in the community in one way or another. And so it's core to who we are as we have grown into other parts of the country. That's been a major part of the hiring of the people that we bring into our company. Is we want to make sure that they are interested in and involved in their local community, and we continue that. I could go on and on and on and list all the different things that we're involved in Connecticut and Florida and Michigan and California and across the country where we're involved, and where we will be in Texas and how we will be in Texas. The other thing that we do with respect to, from a social determinants perspective of being so close to the community and being in transportation, lots of opportunities, and we were involved in social determinants before they were being called social determinants. So, as a taxi company, volunteering to take in inclement weather and bad weather, take the elderly to and from grocery shopping, being involved in school programs where we may have to volunteer to drive kids back and forth, having drivers that are perfectly trained and credentialed for that. And then last, I'll just mention that as our plans have become more and more aware of the impact of social determinants on the outcomes and the wellness of their patients, we are involved in every single market in which we're involved in social determinant programs, value-added services, taking members to and from advisory meetings, taking them to educational meetings. United Healthcare launched a community-based program in Arizona and we were the partner as they utilized transportation for job training and for family counseling and things like that. So big believers in that, and thanks for your time.
Great, thank you, Stan. So I'm hearing different approaches actually from each of the company. I heard Chris talking about really wanting to understand how to fit into the workflows of hospitals, for example, with discharge planning. And it sounds like, Chris, y'all are having a lot of conversations or surveying the provider groups. I'm hearing Monica talk about very specific programs to use transportation resources to really get food and get other things to the home. And then I'm hearing Stan talk about other things that they're doing, like having their employees really be actively involved in the community, helping with transportation to places like schools. So exciting different sets of approaches that you all have there. Thank you for sharing those. I'm going to remind all of our attendees that we are looking forward now to hearing your questions. So as I move on to our next topic, please click on your little chat button on the bottom and send us some questions. I know the panelists are looking forward to answering your questions. Stan, you're back with us, and so I'm going to start with you on this one, if that's okay. You good? All right. Stan, tell us about an initiative or an idea, something that your company is working on for future that is exciting to you, and what types of outcomes you're hoping to create with that. What's exciting about the work you're doing now?
There's a lot that I could talk about there. And I know, we're on a restricted time frame, but being kind of an innovator in a startup, there's a number of things that we're very excited about. But one of the things I haven't had a chance to talk about as it relates to COVID that does respond to that question, the COVID crisis forced all of us to pivot and forced all of us to respond in ways that many of us weren't prepared for. At Veyo, we have these credentialed rideshare drivers that offer a demand response type service that is unprecedented in the industry, with drivers that can transport any ambulatory patient. As the crisis hit us, a lot of pressure was put on the EMS systems with respect to transporting COVID positive patients. But the reality is that COVID positive patients who were exhibiting either minor symptoms or were asymptomatic still needed to get to and from their critical care, dialysis, chemo, et cetera. So working with our customers in Arizona, the regulator, suppliers, and drivers, we identified a key group of drivers, trained them, outfitted them with PPE, went through a number of different protocols to follow CDC guidelines. We customized ambulatory vehicles by creating separators in the vehicle, separate circulation systems, and then created a staging process to clean these vehicles. And so now what we have is and we work with the regulator to create an actual code to transport NEMT patients, COVID positive patients. And then we set up the protocols so that when a patient calls and is being scheduled for critical care, we can identify whether or not they either are or suspected of symptomatic, of COVID symptoms. We can actually transport them in an NEMT vehicle. So what we do is we will contact a driver. These drivers are staged and ready. And of course, yes, we pay them a little bit more. They pick up the patient, they drop off the patient at the healthcare provider that has acknowledged they will see COVID positive patients. They then take their vehicle to a staging center. That vehicle is disinfected, completely sanitized. They change their PPE, they jump in another vehicle that's waiting, and they go pick up the next ambulatory patient. The reason I bring that up is we do see that and specialized fleets being part of the future that we have to face. And we're not only have we been able to build what we call these clean fleets, but we're excited about clean fleets in the future and what the special needs are. So some of the other things we're thinking about as it relates to these fleets are, what else might specially trained and equipped drivers do to support telehealth? Can drivers be equipped with technology iPads in order to take them to a patient who may not be as technically competent as the rest of us and allow that patient to conduct a telehealth visit? Fairly simple, right? Another thing we are looking at doing is expanding the capabilities of our drivers to create either, maybe a physician extender, the ability to do diagnostics, minor type things. What are some of the things that we have to do with our drivers in order to make them a more supportive asset as healthcare continues to morph? So those are some of the things. There's a lot of things we're doing with technology, but I think beginning to morph our supply system to support the movement to home care, telehealth, is certainly what we're doing, in addition to addressing the needs of COVID. So none of us has a crystal ball, but those are some of the things we think are going to be of importance down the road.
Great. And Stan, what are you hoping, or what have you seen that those kinds of specialized fleet services really do for the quality of life, or the anxiety, or the experience of a member?
Well, I mean, just as it is with any, transporting any of these patients, these are for critical care patients, right? We have to coordinate. It's a highly collaborative effort. The healthcare provider has to acknowledge they're able to treat COVID positive patients for dialysis, chemo, whatever it might be, critical behavioral therapy. And so, what's happened to all of us during COVID is we all feel isolated. We all feel like we're sort of trapped, right? And imagine having COVID, but having critical care that you can't get to. It's devastating to see the impact on these patients. And so we responded fairly quickly with this. Once the crisis hit in mid-March, we were, by April, we were launching this, this capability. And our drivers, you think about the drivers putting themselves in this danger to go do this. And so they love doing it, and they want to do more. And they comment all the time about how you wouldn't believe how happy that this member was. That, here's somebody going to and from critical care, dialysis, that they're just happy because they're able to get it done, right? They're not going to the emergency room. They're not going to the ER to either recover from or get their dialysis. And so, yeah, I'm sorry, I'm getting emotional with it, but it's important to do what we all do, what Monica and Chris and our industry does. But I think during this time, it has become even more vitally important for all of us, and to work together on it, right? I mean, this is not about a trip, right? This is about healthcare, and this is about taking care of the patient, and we're just thrilled to be doing it and looking for other ways to respond. So, long answer to your question, Angie. I'm sorry.
Thank you, Stan. I appreciate it. Appreciate that. We know that transportation is much more than a trip for people. Monica, how about for you? What are you excited about? What are you hoping to create?
So I'm excited about three things. One of the things that I'm excited about is really, and building on what Stan, you were saying, and in complete alignment to you, Stan, is it's not a trip. It's part of the care continuum. Mm-hmm. So almost just like the connective tissue where you can really, no pun intended, strategically drive the patient to care and outcomes. So I'm excited about that. I'm excited about technology and our digitization, really not for the outcome of digitization, but as a tool for member experience and getting analytics so that we can drive outcomes. You think about digitization and you think what you could do if you're understanding that this pocket of Medicaid members is using the ED as their primary care provider. And if you understand that systematically in this little pocket, how how do you drive change around that? Do you put in a primary care provider in their community? Do you enhance telehealth? Do you enhance urgent care? And this goes back to our belief that healthcare is very local, but I strongly believe that you cannot impact behavior changes or those changes in outcomes if you don't understand that. So that's why I'm excited about technology as a tool for change. And then the part that I'm most excited about, and I know I've talked about this, is really those drivers along social determinants of health. And Stan, you also talked about this around COVID. So we talk about food, and we've delivered around 15,000 boxes of food to Medicaid beneficiaries, but we're also piloting programs around loneliness. I'm sure you all remember that the past Surgeon General, Vivek Murthy, made loneliness his platform for the country, and this is before COVID. So just think about all the people that are isolated because of COVID right now. So how do you stop that second pandemic of depression and mental health? So I'm really excited, and we're driving a lot of pilots with different payers around loneliness, around housing, and access very concretely to social determinants of health. I think those are the three things that I'm excited about, and agree with Stan. It's all about much more than a ride or transportation.
Great, thank you, Monica. So Monica, you've mentioned a few times your food delivery programs, and you've mentioned now some pilots around loneliness. And I heard you say we definitely want to prevent a new pandemic, for example, of depression, or there are some things that we want to prevent. And at the same time, there's probably resilience and joy, as Stan was talking about, that comes out of some of these programs. There's more to them than just staving off the bad. Tell us, do you have any stories about delivering food or anything that sort of puts some color around what that means to people?
Yeah, so very concretely, we've done a lot of work with the state of New Jersey and their Medicaid beneficiaries, and how we think about it is we need to do this in a very locally driven way. So the story is, our partner in the state of New Jersey was like everyone who's seen these horrific lines in food banks due to COVID, was noticing that their Medicaid beneficiaries did not have access to food, and some of them would drive and stand in line for 6 to 7 hours waiting for the only thing their family could access for food, and would get there and the food pantry would run out of boxes of food. So think of that for a second, being a single mom with 2 kids waiting at home. You have a neighbor take care of them for half a day and coming home with nothing. So we said, I mean, the experience of a lot of Medicaid beneficiaries is just living day by day and not having predictable resources. So how do we take that out, and how do we tell them, raise your hands, and if you are food insecure, we will bring a box of food for your full family that will last a week. So we did that, and kind of how I think about it is going back to what Chris and Stan and you were also saying about how healthcare is very locally driven. So our story and our experience in New Jersey and Pennsylvania and Florida has been a very locally driven story where we partner with food pantries. We partner with our transportation providers and say, let's all huddle around community needs. It's great for the transportation provider because some of these are not prepared, to Stan's point, for providing COVID positive patients to and from care, but they still want to work and they still want to provide rides, so they can provide food boxes. It's great for the TPs, great for the Medicaid beneficiaries, great for the food pantries. So some of the things we've heard in some of our communities is, we have food boxes, but we have nowhere to store them. We don't have a way to have kind of that big box parking lot thing where we distribute food. We want to give it. So how do you do it? So it's really around that creative way of working with your local partners to really drive that. And we, obviously hospitals and MCOs understand the ecosystem much better than we do. So we just like to sit at the table and say, what are the resources and how can we connect them to members?
Great. Thank you so much, Monica. Chris, I'm interested in hearing from you. What are you excited about that you're working on? What do you hope to create from those programs?
So really integrating medical transportation, the overall scope of care is a primary goal for our organization. As Monica mentioned, using transportation for food delivery or, bringing supplies to COVID positive patients. That's something we're doing across the nation, also in Texas, as a value added transportation benefit. Using our technology and our mobile app to become more demand oriented, so people who need to get to the pharmacy can get there. But really also getting away from logistics, what we can do for the overall health and well-being of your members, ways we can improve HEDIS measures such as diabetic blood draws, some of the really exciting things being implemented in Texas today. We recently implemented our nurse navigation program in Arlington, Texas, for example. How that works is 911 dispatchers refer low acuity calls to our nurses to be navigated to the right care at the right place at the right time. We use rideshare to transport someone to an urgent care facility or an alternate destination. And patients might not even need transport at all, simply receiving self-care instructions from our nurses. Medicaid plans are reporting over $700 savings per nurse interaction, so it's been a very successful program for us. In addition to that, CMS's ET3 pilot, or Emergency Triage, Treat, and Transport, that's coming to Texas. That will allow for 911 responders who arrive for low acuity calls to transport to an alternative destination or even provide treatment in place. Our organization was selected by CMS to implement ET3 in 13 Texas counties. It was originally supposed to launch this past May, but of course, COVID has delayed the program. They're still saying this fall, but it likely be a Q1 2021 launch is what we're preparing for. So those are some of the things that we're really excited for, that we're in the process of implementing or coming in the coming months to Texas.
Great, thank you, Chris. What are your thoughts? What have you heard or seen, or what are your hopes for your new programs for diversion? What do you think that will do for members who are partnering with you on these programs?
It's really increased the efficiencies of the program, patient satisfaction, and just getting the appropriate access to healthcare, getting them back into seeing network providers, not using the hospital for PCP visits, for example, and making sure that they are getting timely access to healthcare. When you're triaged in an ER, for example, you could be sitting there for hours for low acuity. Transporting somebody by Lyft, and our average response response time or wait time is 7 minutes with Lyft. Getting them to an urgent care facility where they can oftentimes be seen much quicker than going to an ED and waiting, and then getting them back home very quickly. It also changes that member's behavior and connects them with their case manager and gets them back into the network and assistance directly from that health plan. So it's been extremely successful in the multiple markets outside of Texas. As I mentioned, it's being brought into Arlington, and ET3 will also have a nurse navigation component when it's brought to Texas in those 13 counties that will operate later, hopefully later this year, but again, likely beginning of next.
Great. Thank you, Chris. Thank you. Well, panelists, we've got about 10 minutes left. And so in our time together, I'd like to get some advice from y'all. And I'm going to start with Monica. Monica, as a vendor, as a transportation vendor who has experience across the country, what advice do you have for us as plans as we develop and manage our transportation benefits?
Thank you, Angie. So the advice that I have is very very concrete, and then you back away from that. So don't think of transportation as being on the side and kind of, oh, it's not really healthcare. Think about it as a way for access to healthcare and population management of your beneficiaries. And if you think about that, it goes back to my original statement about COVID. It's about getting care to patients instead of getting patients to care. And design your strategy and your program and your access with that lens. I think that will be beneficial to you as a plan and to your members.
Cool. Stan, what are your thoughts? What advice do you have for us?
That's that's a great question, and completely agree, Monica, with you with respect to the word vendor. I'm sure with both Monica and Chris is core to what we are all in our industry trying to change, right? Historically, we in doing what we do have been considered one of the health plan or one of the agency's vendors. And we're trying really, really hard to put everything in place we need to put in place to become a healthcare partner, because that's how we view what we do. I didn't get a chance to respond to the first part of the question because of my fault with respect to what we've seen in COVID and what's happened. But the integrating logistics into the overall healthcare is vitally important. It's why social determinants is such a big deal outside of Medicaid or outside of the medical treatment, right? It's because it's so vitally important. So back to, that's really core to the message that we always have with respect to transitions. As we've grown quickly across the country, transitions have become something that we have to be really expert at, but we can't be an expert at it without collaboration. So partnership in a number of different things, right, is what we would encourage, especially when you're looking at a situation like this where it's a carve-in, where it's a new benefit. So we have 5 bullets. I won't expand on them in any great detail, but there are 5 things that we really focus on. First is, right at the beginning, collaborating on plan design and the benefit itself, and really being clear with respect to what the benefit is, what it looks like, how we're going to manage it, how we're going to collaborate on it, right? And then integrating the plan and the protocols into both the health plan's operation and systems, as well as your partner who's going to manage this benefit, whereby every piece of that plan, every protocol, everything can be driven from the member need, and that it's transparent and it can work that way. So, and you can actually in real time see that the specific member need is driving every single behavior beyond that, right? So make sure that it can be integrated to the best of your ability, that you can integrate into your systems, the ability to ensure that. Third is engagement of every stakeholder in the process from the beginning: members, healthcare, community, advocates, the community itself, the senior centers. Every single stakeholder in this process needs to be engaged in the transition so that we can make it as seamless as possible on all of us, right? Outbound communication, community meetings, outreach, all different modes doing all those things, but it has to be done, and you can't start that early enough. Data, and innovation, right? So there are performance parameters. There's things that we all have to behave to on our side, right? As the partner, we have to, service levels, grievances, on-time performance, no-shows, all those things that we have to adhere to. But there's more data than that, and data in real time. Set yourselves up to be able to measure in real time as much as possible. With data, you can make great decisions. and ensure that your partner can pivot quickly and that you can pivot quickly in order to make the kind of moves that you need to make in order to ensure continuous improvement. So data is key. And then when it comes down to that time, right, that critical time, the 2 weeks or the 4 weeks prior to the transition, a truly seamless, a plan that incorporates all pieces of this that has been worked on for months ahead of time, so that as we transition, all of those things that I just mentioned can come to bear to ensure that on that day when we when we open the curtains to the car bin, it's as seamless as possible. Something as simple as, do we know every single member's preferred provider, and has that been scheduled and organized and planned for that member the day after the transition? There's a lot to it, but those are the 5 bullets that we believe are important in any transition like this.
Thank you, Stan.
Mm-hmm.
Chris, what advice do you have for us at the plans who are developing benefits and implementing?
Well, just to go off of what Stan was saying, I think the general message is the execution of an NEMT program is not easy. It's going to take that education of all the stakeholders, very meaningful technology, fully built technology, and the flexibility to be successful. Again, just going back to the education. So not only the education for the health plan staff and members, but also transportation providers, the medical providers. This is going to be a big change for them, and in other carve-ins, that's where oftentimes some of those stakeholders were left out in those discussions, and it had a significant impact post-implementation. Going back to the technology, it must be very purposeful, rules-driven to execute, to have the flexibility in a program and meet the local stakeholders' needs. You have to have the technology that can develop the rules to be able to manage that benefit appropriately. Going back to what Stan was saying about the protocols and the program design, you can design a program, but if you don't have the tools to actually implement that program and manage that benefit successfully, that will be a huge challenge for the plans. In addition to rideshare, since rideshare is going to be new to Texas as far as from a non-emergency, or what House Bill 1576 refers to as non-medical transportation, it needs to be managed, or it can place considerable risk on the plan. All members must be assessed to ensure it's appropriate. And again, the tools developed to manage rideshare, the suite of tools that we created has led to 97 to 98% on-time performance of rideshare month over month. And we've completed millions of rideshare trips across the country. Before we had those tools, before we had a center of excellence that monitored pickup times proactively to ensure that the members and drivers connected, we found rideshare generally was below 85% on time to appointments, and 1 in 12 members missed their trips because they had challenges connecting with that driver, whether it was just a change in process from what they were used to with traditional providers, or they just didn't have the education and understanding of how the technology works. So again, it's go back to it's a combination of having the education in place as well as the technology to be able to manage those services appropriately.
Mm-hmm.
Great. Thank you, Chris.
Right.
Well, panelists today, I think my takeaway from what we've talked about is when it comes to transportation, it's more than a ride, right? It means something to our members. It means something to the drivers, and it involves lots of stakeholders who we're going to have to get together with, which is one of my favorites. So we get to really work with our stakeholders, with our vendor partners as partners, and plan this together to make it more than a ride. So thank you to all the attendees for joining us today, and thank you to our sponsors. Thank you, panelists, Monica Rivera, LogistiCare, Chris Irwin, Access to Care, and Stanton Sipes from Veyo. Thank you. For all of our attendees, the next panel starts at 9:30. That will be a discussion with Representative Phelan. So please join for that. To join, you're going to click on the link to that panel on the website. Thank you all, and have a fantastic rest of your morning.
Thank you for having us,
Angie.
Angie. Bye.
Thanks, Angie. Thanks, Monica and Chris. Great to see you both again.
You
Good
too,
to see you.
Stan.
Bye.
Thank you.